"72-year-old Namwandu Kitio cannot recall exactly when the back pain started, but she has had the pains for as long as she can remember. In the last 2 years, however, the pain became so intense and unbearable, forcing her to go from hospital to hospital in search of relief.
I feel a throbbing pain in the back and it spreads all the way to the legs."
Namwandu's case is a typical one for backache. Back pain is pain felt in the back, usually originating from the muscles, nerves, bones, joints, or from other structures in the spine. Back pain may have a sudden onset or can be chronic. The pain can be constant or intermittent, usually felt as a dull ache, a sharp pain, or even a piercing or burning sensation. Due to the complex nature of the spine, the pain may also spread into the arm and hand, in the upper back or in the lower back, and further into the leg or foot. It may also produce other symptoms such as weakness, numbness, or tingling. There are several situations that can cause back pain, including pregnancy, trauma, cancer, infection, fractures, and inflammatory disease. In most cases, however, back pains are the result of poor working habits.
Your eyes are supposed to be on top of the monitor because we read at an angle, we don't read straight. The distance in between your eyes and the monitor is supposed to be between 41 to 95 centimeters according to how you can accommodate the light in between. When you are typing, your arms are also supposed to remain in line with your body. That is ear, shoulder, elbow, hip.
Sitting properly prevents you from craning your neck or curving your back to reach your computer, thus saving you from backache. But it's not only office workers who are at risk of back pain. Care should be taken too when lifting heavy loads and doing housework.
For washing, whether they are dishes or they are clothes, you are supposed to have a raised table so that you wash while standing. There is no bending. Bending causes more harm to your back, and most especially the long periods you spend when you are washing.
Studies also suggest that psychosocial factors such as on-the-job stress and dysfunctional family relationships may cause backache. In most cases, as many as 85% of back pain cases, however, no physiological cause can be shown. Back pain does not usually require medical intervention. In many instances, it is self-limiting and non-progressive and will typically last for 2 weeks to 3 months. Back pain can be managed and prevented simply unless it's associated with a serious medical problem. For instance, taking breaks when doing something for long periods can prevent and relieve backache. Experts also advise people to stretch a bit and then resume work to prevent strain. For Namwandu Kitio, doctors gave her this belt plus a regimen of exercises and painkillers that have helped her get along. She can now walk, do light chores around the house as long as she does not have to bend. Exercise is said to be effective for reducing back pain, but this should be done under professional supervision and only for chronic back pain and not acute back pain.
In most cases, when we have pain in our backs, we tend to avoid movement. And in avoiding movement, you protect the pain and preserve it there, and that makes it worse. But when you move at the end of it all, you relieve the pain. So our exercises in the beginning part of it is we give them to relieve the pain. Then afterwards, after the patient has all the pain has gone away, we give exercises to strengthen his back.
Other treatments include use of medications, heat therapy, massage, acupuncture, and sometimes surgery. Not all treatments, however, work for all conditions or for all individuals with the same condition. Some people may find that they need to try several treatment options to determine what works best for them. Anna Tkunda, NTV. Thank you.